Question 1. The assessment process reveals a patient with complex multi-system organ failure requiring advanced critical care interventions and a coordinated interdisciplinary approach. The clinical nurse specialist, CNS, has identified significant gaps in the current unit protocols for managing such patients, leading to suboptimal outcomes and increased risk of complications. The CNS is also aware of a recent policy change at the organizational level that may impact resource allocation for high-acuity patients. Considering the CNS's role in improving patient outcomes and influencing healthcare systems, which of the following actions best aligns with their scope of practice? Option A. Initiate a comprehensive review of existing unit protocols for managing multi-system organ failure, develop evidence-based recommendations for revision, and collaborate with the interdisciplinary team and unit leadership to implement these changes, while also advocating for appropriate resource allocation based on the new organizational policy. Option B. Delegate the management of the patient's complex care plan and all advanced interventions to the most experienced registered nurses on the unit, providing only general oversight. Option C. Focus solely on providing direct patient education to the patient and their family regarding the patient's condition and prognosis, without addressing systemic issues or protocol deficiencies. Option D. Directly assume responsibility for all direct bedside care of the patient, including performing all advanced procedures, to ensure the highest level of immediate attention and expertise is provided. The correct answer is A. Initiate a comprehensive review of existing unit protocols for managing multi-system organ failure, develop evidence-based recommendations for revision, and collaborate with the interdisciplinary team and unit leadership to implement these changes, while also advocating for appropriate resource allocation based on the new organizational policy. Explanation. The assessment process reveals a complex clinical situation where a clinical nurse specialist, CNS, must navigate the boundaries of their advanced practice role within the established regulatory framework. The challenge lies in identifying the most appropriate action that aligns with the CNS's scope of practice, which is defined by state nurse practice acts and professional organizational standards. This scenario requires careful judgment to ensure patient safety and adherence to legal and ethical guidelines. The correct approach represents best professional practice because it directly addresses the identified patient need by leveraging the CNS's expertise in a manner consistent with their advanced role. This involves utilizing their knowledge to influence care delivery systems, educate staff, and implement evidence-based interventions, all of which fall within the recognized scope of a CNS. This approach prioritizes patient outcomes through systemic improvement and advanced clinical reasoning, as supported by regulatory definitions of CNS practice. An incorrect approach that involves performing tasks clearly outside the defined scope of a CNS, such as independently prescribing medications without appropriate licensure or collaborative agreements, represents a significant regulatory and ethical failure. This action would violate the Nurse Practice Act, potentially leading to disciplinary action and compromising patient safety due to practicing beyond authorized limits. Another incorrect approach, such as delegating advanced clinical decision-making to unlicensed personnel, is also a failure. This undermines the CNS's responsibility for oversight and accountability for complex patient care, violating ethical principles of professional responsibility and potentially leading to adverse patient events. A third incorrect approach, focusing solely on direct patient care without addressing the systemic issues identified, fails to fully utilize the CNS's unique role in improving healthcare outcomes across populations or units. While direct care is part of nursing, the CNS role is specifically designed to impact care at a broader level, and neglecting this aspect represents a failure to optimize their advanced practice contribution. Professionals should use a decision-making framework that begins with a thorough understanding of their state's Nurse Practice Act and relevant professional standards. This involves critically evaluating the patient's needs against the defined competencies and responsibilities of their advanced practice role. When faced with complex situations, professionals should consult with peers, mentors, and regulatory bodies if there is any ambiguity. The process should prioritize patient safety, ethical considerations, and adherence to legal boundaries, ensuring that all actions are within the authorized scope of practice. Question 2. The audit findings indicate a pattern of delayed diagnosis and suboptimal management of patients presenting with acute anemia. As a clinical nurse specialist, CNS, overseeing care for these individuals. Which of the following approaches best addresses the identified deficiencies and ensures adherence to best practices in hematological disorder management? Option A. Implement a standardized protocol for immediate intravenous iron supplementation for all patients presenting with acute anemia, irrespective of the underlying cause, to rapidly improve hemoglobin levels. Option B. Conduct a comprehensive review of patient records to identify trends in presenting symptoms, laboratory values, and diagnostic workups for acute anemia, and subsequently develop targeted educational interventions for the nursing staff on the differential diagnosis and appropriate initial management of various hematological disorders. Option C. Encourage nurses to rely on their clinical experience and intuition when managing patients with acute anemia, as this often leads to quicker identification of the most critical cases. Option D. Focus on managing the immediate symptoms of anemia, such as fatigue and shortness of breath, through supportive care and oxygen therapy, while awaiting further specialist consultation for definitive diagnosis. Correct answer is A. Implement a standardized protocol for immediate intravenous iron supplementation for all patients presenting with acute anemia, irrespective of the underlying cause, to rapidly improve hemoglobin levels. Explanation: this scenario is professionally challenging due to the critical nature of hematological disorders, the potential for rapid patient deterioration, and the requirement for precise, evidence-based interventions. CNS must navigate complex patient presentations, integrate diagnostic data, and implement appropriate management strategies while adhering to established clinical guidelines and professional standards of care. The correct approach represents best professional practice because it prioritizes a comprehensive, systematic assessment of the patient's hematological status. This involves a thorough review of laboratory results, clinical signs and symptoms, and the patient's medical history to accurately diagnose the specific hematological disorder. Subsequently, it emphasizes the development of an individualized, evidence-based treatment plan, which aligns with regulatory requirements for quality patient care and ethical obligations to provide competent, safe, and effective nursing practice. This approach ensures that interventions are tailored to the patient's unique needs and the specific pathophysiology of their condition, thereby optimizing outcomes and minimizing risks. An incorrect approach that focuses solely on symptomatic relief without a definitive diagnosis fails to meet professional standards. This neglects the underlying hematological pathology, potentially delaying crucial treatment and leading to adverse events or disease progression. Such an approach could be considered a breach of the duty of care, as it does not demonstrate the diligent investigation and management expected of a CNS. Another incorrect approach that relies on anecdotal evidence or outdated practices is ethically and regulatorily unacceptable. Professional practice mandates adherence to current, evidence-based guidelines and research. Deviating from this standard can result in suboptimal care, patient harm, and potential legal ramifications. It demonstrates a failure to maintain professional competence and a disregard for the principles of evidence-based practice, which are fundamental to safe and effective healthcare delivery. The professional decision-making process for similar situations should involve a structured approach. 1. Recognize and validate the audit findings. 2. Conduct a thorough, systematic assessment of the patient's condition, integrating all available data. 3. Formulate a differential diagnosis based on the assessment. 4. Consult relevant evidence-based guidelines and literature. 5. Develop and implement an individualized evidence-based plan of care. 6. Continuously monitor the patient's response to treatment and adjust the plan as necessary. 7. Document all assessments, interventions, and outcomes meticulously. 8. Seek consultation from other healthcare professionals when indicated. Question 3. Stakeholder feedback indicates a patient diagnosed with a complex autoimmune disorder is expressing a strong desire to pursue an unproven experimental herbal supplement regimen, citing anecdotal success stories from online forums, despite their current conventional treatment plan showing stability. As a clinical nurse specialist, how should you best address this situation? Option A. Report the patient's interest in alternative therapies to their primary physician without direct discussion, as this is outside the scope of your direct treatment authority. Option B. Immediately dismiss the patient's interest in the herbal supplement, firmly reiterating the importance of adhering strictly to their prescribed conventional treatment plan. Option C. Agree to administer the herbal supplement as requested by the patient, assuming it is a harmless complementary therapy. To maintain patient satisfaction, option D, engage in a thorough discussion with the patient to understand their motivations. Provide comprehensive education on the risks and benefits of both conventional and the proposed alternative therapy based on current evidence, and collaboratively explore their treatment goals and preferences. The correct answer is D. Engage in a thorough discussion with the patient to understand their motivations. Provide comprehensive education on the risks and benefits of both conventional and the proposed alternative therapy based on current evidence, and collaboratively explore their treatment goals and preferences. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's autonomy and the clinical nurse specialist's (CNS) professional responsibility to ensure evidence-based care and patient safety, particularly when dealing with complex immune system disorders. The patient's desire for an unproven, alternative therapy, despite significant risks and lack of scientific validation, directly clashes with the CNS's ethical and professional obligations. Careful judgment is required to navigate this delicate balance, respecting the patient's right to make decisions about their health while also upholding the standards of professional nursing practice. The correct approach represents best professional practice because it prioritizes patient well-being through open communication, education, and collaborative decision-making, all within the bounds of established regulatory and ethical frameworks. This involves a thorough assessment of the patient's understanding, exploring their motivations, and providing accurate, evidence-based information about both the proposed alternative therapy and conventional treatment options. The CNS must act as a patient advocate, ensuring the patient is fully informed of the potential benefits, risks, and uncertainties associated with all treatment choices, thereby supporting their autonomous decision-making. This aligns with the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and respect for autonomy. Regulatory guidelines for advanced practice nurses emphasize the importance of patient education, informed consent, and adherence to evidence-based practice. An incorrect approach that involves immediately dismissing the patient's request without exploration fails to respect patient autonomy and can erode the therapeutic relationship. This approach neglects the CNS's duty to understand the patient's perspective and provide comprehensive education, potentially leading to the patient seeking care elsewhere without adequate support or information, which is a failure in professional advocacy and could be seen as a breach of the duty of care. Another incorrect approach, such as agreeing to administer the unproven therapy without sufficient evidence of safety and efficacy, or without proper consultation and oversight, would violate the principles of non-maleficence and beneficence. This would also contravene regulatory requirements for advanced practice nurses, which mandate practicing within the scope of their licensure and adhering to evidence-based guidelines. Such an action could expose the patient to significant harm and the CNS to professional disciplinary action. A further incorrect approach, such as reporting the patient to authorities for seeking alternative therapies, is an overreach and a violation of patient privacy and autonomy, unless there is clear evidence of abuse, neglect, or immediate danger to self or others. This action would be ethically unsound and likely not supported by regulatory frameworks governing nursing practice. The professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and validate the patient's concerns and desires. Second, conduct a comprehensive assessment of the patient's understanding of their condition and treatment options. Third, provide clear, unbiased, and evidence-based information about all available therapies, including potential benefits, risks, and uncertainties. Fourth, explore the patient's values, beliefs, and motivations for considering the alternative therapy. Fifth, engage in shared decision-making, empowering the patient to make an informed choice that aligns with their goals of care. Finally, document all discussions and decisions thoroughly, and consult with colleagues or supervisors when complex ethical or clinical issues arise. Question 4. Investigation of a patient presenting with sudden onset of left-sided weakness, facial droop, and slurred speech, with a last known well time of 2 hours prior to arrival, requires the clinical nurse specialist to determine the most appropriate immediate course of action. Option A. Initiate a broad diagnostic workup including extensive blood tests and cardiac monitoring before considering any acute neurological interventions. Option B. Defer all immediate management decisions to the attending physician, providing only basic vital sign monitoring. Option C. Focus on managing the patient's symptoms with comfort measures and await further physician orders for diagnostic testing. Option D. Conduct a comprehensive neurological assessment, review the patient's CT scan results, and collaborate with the interdisciplinary team to initiate evidence-based thrombolytic therapy according to established stroke protocols. The correct answer is D. Conduct a comprehensive neurological assessment, review the patient's CT scan results, and collaborate with the interdisciplinary team to initiate evidence-based thrombolytic therapy according to established stroke protocols. Explanation. Scenario analysis. This scenario presents a professional challenge due to the complex and rapidly evolving nature of neurological conditions, specifically stroke, and the critical need for timely and evidence-based interventions. The CNS must navigate patient variability, potential for rapid deterioration, and the imperative to adhere to established clinical pathways and best practices to optimize patient outcomes. The challenge lies in synthesizing current patient status with established protocols and anticipating potential complications. Correct approach analysis. The correct approach, which involves a comprehensive neurological assessment, review of diagnostic imaging, and consultation with the interdisciplinary team to initiate evidence-based thrombolytic therapy according to established protocols, represents best professional practice. This aligns with regulatory frameworks that mandate the provision of high-quality, evidence-based care. Ethical principles of beneficence and non-maleficence require the CNS to act in the patient's best interest, which includes timely and appropriate treatment for conditions like stroke. Adherence to established protocols ensures consistency, safety, and optimal outcomes, reflecting professional accountability and commitment to patient well-being. Incorrect approaches analysis. Initiating a broad diagnostic workup without immediate consideration for time-sensitive interventions for suspected stroke would be a regulatory and ethical failure. This delays potentially life-saving treatment, violating the principle of beneficence and potentially leading to poorer outcomes, which could be considered a breach of professional duty of care. Focusing solely on symptom management without addressing the underlying cause, e.g., potential ischemic stroke, would also be a failure. This approach neglects the primary pathology and the opportunity for restorative interventions, contravening the mandate for comprehensive and effective patient care. Deferring all decision-making to the physician without actively participating in the assessment and recommendation process would be a failure to utilize the CNS's advanced practice expertise. Regulatory guidelines for CNS practice emphasize their role in leadership, consultation, and direct patient care, including critical decision-making within their scope. This inaction could also delay necessary interventions. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a rapid, focused assessment of the patient's presenting signs and symptoms. This should be followed by a critical review of available diagnostic data and a thorough understanding of established clinical guidelines and protocols relevant to the suspected condition. Collaboration with the interdisciplinary team is paramount, leveraging the collective expertise to formulate and implement the most appropriate and timely treatment plan. Continuous evaluation of the patient's response to treatment and anticipation of potential complications are also essential components of this framework. Question 5. What factors determine the appropriate depth and breadth of a neurological assessment conducted by a clinical nurse specialist when evaluating a patient with new-onset focal neurological deficits? Option A. The patient's presenting symptoms, medical history, vital signs, and the suspected underlying etiology of the deficits. Option B. The patient's level of consciousness and the presence of any immediate life-threatening signs, irrespective of other findings. Option C. The nurse's personal experience with similar neurological conditions and the time constraints of the clinical shift. Option D. The availability of advanced diagnostic imaging modalities and the preferences of the attending physician. Correct answer is A. The patient's presenting symptoms, medical history, vital signs, and the suspected underlying etiology of the deficits. Explanation. This scenario is professionally challenging because a clinical nurse specialist, CNS, must integrate complex neurological assessment findings with a patient's subjective experience and the evolving clinical picture to advocate for appropriate care. The CNS's role necessitates a holistic approach, moving beyond isolated data points to understand the implications for patient outcomes and resource allocation. Careful judgment is required to prioritize interventions and communicate effectively with the interdisciplinary team, ensuring patient safety and adherence to best practices. The correct approach represents best professional practice because it emphasizes a comprehensive and individualized assessment that considers the patient's unique presentation, potential underlying pathologies, and the impact on their functional status. This aligns with the CNS's responsibility to provide expert consultation, facilitate evidence-based practice, and influence care delivery at the unit or system level. Adherence to established neurological assessment protocols, such as those outlined by relevant professional nursing organizations and regulatory bodies governing advanced practice nursing in the specified jurisdiction, is paramount. This approach ensures that the assessment is systematic, thorough, and contributes to accurate diagnosis and effective treatment planning, thereby upholding the ethical obligation to provide competent and compassionate care. An incorrect approach that focuses solely on a single, isolated neurological sign, without considering the broader clinical context, fails to meet the standard of care. This could lead to misdiagnosis or delayed recognition of a deteriorating condition, potentially violating the duty of care and professional accountability. Another incorrect approach that relies on outdated or unvalidated assessment techniques will be ethically problematic, as it deviates from evidence-based practice and could compromise patient safety. Furthermore, an approach that neglects to involve the patient or their family in the assessment process, where appropriate, would be a failure to uphold patient autonomy and the principles of patient-centered care, which are often enshrined in professional codes of conduct and regulatory guidelines. Professionals should employ a systematic decision-making framework that begins with a thorough review of the patient's history and current presentation. This is followed by a targeted, yet comprehensive, neurological assessment, integrating subjective reports with objective findings. The CNS then synthesizes this information, considering differential diagnoses and potential interventions. Crucially, this synthesis informs communication with the interdisciplinary team, advocating for the patient's needs based on expert assessment and evidence. Continuous reevaluation and adaptation of the plan of care are essential components of this process. Question 6. When evaluating a patient with newly diagnosed heart failure, which approach best aligns with the regulatory framework and ethical guidelines for a clinical nurse specialist practicing in the United States? Option A. Immediately prescribe a diuretic based on the patient's reported shortness of breath, assuming it is fluid overload. Option B. Focus solely on educating the patient about the disease process without assessing their current understanding or readiness to learn. Option C. Initiate a comprehensive assessment of the patient's cardiovascular status, functional capacity, psychosocial well-being, and existing comorbidities. Then develop a collaborative, evidence-based, individualized care plan. Option D. Rely on personal experience from previous patient encounters to manage the heart failure symptoms without further diagnostic workup. The correct answer is C. Initiate a comprehensive assessment of the patient's cardiovascular status, functional capacity, psychosocial well-being, and existing comorbidities. Then develop a collaborative, evidence-based, individualized care plan. Explanation. This scenario presents a professional challenge due to the inherent complexity of managing patients with chronic cardiovascular conditions, requiring a clinical nurse specialist, CNS, to integrate advanced knowledge, clinical judgment, and adherence to established regulatory frameworks. The challenge lies in balancing evidence-based practice with individual patient needs, while ensuring all interventions align with the scope of practice and patient safety standards mandated by the relevant regulatory body for CNS practice in the United States. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered assessment that directly informs the development of a personalized care plan. This aligns with the American Nurses Association (ANA) Standards of Practice and the American Association of Critical Care Nurses (ACN) Synergy model, which emphasize the CNS's role in assessment, diagnosis, outcome identification, planning, implementation, and evaluation. Specifically, it adheres to the regulatory expectation that CNSs practice within their defined scope, utilizing critical thinking to address complex patient needs and promote optimal health outcomes. This approach ensures that interventions are not only clinically sound, but also ethically defensible and legally compliant with state nurse practice acts and federal healthcare regulations. An incorrect approach that focuses solely on symptom management without a thorough underlying assessment fails to meet the regulatory requirement for comprehensive patient evaluation. This could lead to masking underlying issues, delaying appropriate diagnosis, and ultimately compromising patient safety, which is a direct violation of the CNS's ethical and legal duty of care. Another incorrect approach that relies on outdated protocols or anecdotal evidence, rather than current evidence-based guidelines, demonstrates a failure to maintain professional competence and adhere to the regulatory expectation of providing high-quality, up-to-date care. This can result in suboptimal patient outcomes and potential harm, contravening the principles of professional accountability and the standards set forth by regulatory bodies. A third incorrect approach that bypasses interdisciplinary collaboration neglects the regulatory emphasis on teamwork and communication in healthcare. Effective management of cardiovascular disorders often requires coordinated efforts from physicians, pharmacists, dietitians, and other specialists. Failing to engage these professionals can lead to fragmented care, missed opportunities for intervention, and an increased risk of adverse events, all of which are contrary to the spirit and letter of healthcare regulations promoting patient safety and coordinated care. The professional decision-making process for similar situations should involve a systematic approach. First, conducting a thorough and individualized patient assessment. Second, synthesizing this data with current evidence-based practice guidelines and regulatory requirements. Third, developing a collaborative patient-centered plan of care. Fourth, implementing the plan with appropriate interventions. And finally, continuously evaluating the patient's response and modifying the plan as needed. This iterative process ensures that care is safe, effective, and compliant with all applicable regulations and ethical standards. Question 7. The evaluation methodology shows that a clinical nurse specialist is assessing the effectiveness of a new hand hygiene protocol designed to reduce healthcare-associated infections. Which of the following evaluation approaches would best demonstrate adherence to best practices in infection prevention and control? Option A. Examining the inventory records of hand hygiene supplies and assessing the ease of access to hand-washing stations. Option B. Analyzing patient infection rates and comparing them to baseline data, alongside direct observation of staff performing hand hygiene at key moments. Option C. Reviewing staff self-reported adherence logs for the new hand hygiene protocol and surveying staff satisfaction with the protocol. Option D. Collecting patient feedback on the perceived cleanliness of the healthcare environment and reviewing the protocol's theoretical benefits. The correct answer is B. Analyzing patient infection rates and comparing them to baseline data, alongside direct observation of staff performing hand hygiene at key moments. Explanation. Scenario analysis. This scenario presents a common challenge in clinical practice where a clinical nurse specialist, CNS, must evaluate the effectiveness of an infection control protocol. The challenge lies in discerning which evaluation methodology best reflects adherence to evidence-based practice and regulatory compliance, particularly concerning patient safety and the prevention of healthcare-associated infections. The CNS must consider not only the immediate outcomes, but also the systemic factors influencing protocol implementation and patient well-being. Correct approach analysis. The correct approach, focusing on a multifaceted evaluation including direct observation of staff adherence, patient outcome data e.g., HAI rates, and staff feedback, represents best professional practice. This aligns with regulatory frameworks that mandate robust infection prevention and control programs, emphasizing continuous quality improvement. For instance, in the U.S., the Centers for Medicare and Medicaid Services, CMS, and the Centers for Disease Control and Prevention, CDC, provide guidelines and mandates for infection control. Direct observation ensures fidelity to the protocol as intended. Patient outcomes provide objective evidence of effectiveness, and staff feedback identifies barriers to implementation and areas for improvement. This comprehensive approach is ethically sound, prioritizing patient safety and promoting a culture of safety within the healthcare setting. Incorrect approach is analysis. An approach solely focused on patient outcome data without assessing process adherence is insufficient. While HAI rates are critical indicators, they do not explain why infections are occurring or not occurring. This approach risks misattributing outcomes to the protocol itself when other factors might be at play. or failing to identify critical breakdowns in implementation that could be corrected. Ethically, it may fall short of the duty to proactively identify and mitigate risks. An approach that relies exclusively on staff self-reporting of adherence is problematic. Self-reporting is prone to bias, social desirability, and memory lapses, making it an unreliable measure of actual practice. Regulatory bodies expect objective data, not subjective accounts, to validate the effectiveness of infection control measures. This approach fails to meet the standard of due diligence required for patient safety. An approach that only considers the availability of infection control supplies without evaluating their actual use or the protocol's impact on patient outcomes is incomplete. While adequate supplies are a prerequisite, their mere presence does not guarantee proper utilization or prevent infections. This approach neglects the critical elements of practice and patient well-being, failing to provide a true measure of the protocol's effectiveness. Professional reasoning. Professionals should employ a systematic and evidence-based approach to evaluating clinical protocols. This involves defining clear objectives, selecting appropriate metrics that capture both process and outcome measures, and utilizing reliable data collection methods. When evaluating infection control protocols, a combination of direct observation, objective patient data, and qualitative feedback from frontline staff provides the most robust and actionable insights. This aligns with the principles of continuous quality improvement and regulatory compliance, ensuring that patient care is safe, effective, and evidence-based. Question 8. The performance metrics show a consistent upward trend in HbA1c level for patients managed by the clinical nurse specialist for type 2 diabetes over the past 6 months. Option A. Immediately implement a new, unproven diabetes medication across all patients in the practice, assuming it will reverse the observed trend. Option B. Focus solely on increasing the frequency of HbA1c testing for all patients, without altering the current management approach. Option C. Initiate a comprehensive review of the CNS's patient population, including a detailed analysis of individual patient adherence to medication and lifestyle recommendations, assessment of current treatment protocols against the latest evidence-based guidelines for type 2 diabetes management, and exploration of potential barriers to care, followed by targeted interventions based on identified root causes. Option D. Disregard the HbA1c trend, attributing it to seasonal variations in patient behavior, and continue with existing management strategies. The correct answer is C. Initiate a comprehensive review of the CNS's patient population, including a detailed analysis of individual patient adherence to medication and lifestyle recommendations, assessment of current treatment protocol against the latest evidence-based guidelines for type 2 diabetes management, and exploration of potential barriers to care, followed by targeted interventions based on identified root causes. Explanation. Scenario analysis. This scenario presents a common challenge in advanced practice nursing where performance metrics, while indicating a trend, do not fully capture the nuanced clinical judgment required for complex endocrine disorders. The challenge lies in balancing quantitative data with qualitative patient outcomes and the evolving nature of evidence-based practice. A CNS must critically evaluate the data, considering patient-specific factors and the limitations of the metrics themselves, rather than blindly adhering to them. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered evaluation that integrates performance data with clinical expertise and current evidence. This aligns with the core tenets of advanced practice nursing, emphasizing critical thinking, holistic care, and continuous quality improvement. Specifically, it reflects the CNS's responsibility to not only monitor outcomes, but also to investigate the underlying causes of deviations, ensuring that interventions are evidence-based and tailored to individual patient needs. This approach upholds ethical obligations to provide competent and compassionate care, as well as regulatory requirements for maintaining high standards of practice and contributing to quality improvement initiatives within the healthcare system. Incorrect approach is analysis. One incorrect approach fails by solely focusing on the numerical trend without investigating the clinical context. This is a regulatory and ethical failure because it neglects the CNS's duty to understand the why behind the data, potentially leading to misinterpretation and inappropriate interventions. It bypasses the critical analysis required for effective patient management and quality improvement, violating professional standards of care. Another incorrect approach is to dismiss the performance metrics entirely without a thorough review. This represents a failure to engage with quality improvement processes mandated by regulatory bodies and professional organizations. It also demonstrates a lack of commitment to evidence-based practice and continuous learning, potentially leaving patient care suboptimal and failing to identify systemic issues that could be addressed. A third incorrect approach, which involves implementing a broad, unvalidated intervention based solely on the observed trend, is also professionally unacceptable. This approach risks patient harm by introducing interventions without sufficient evidence of efficacy or safety for the specific patient population. It bypasses the rigorous evaluation and validation processes essential for evidence-based practice and quality improvement, violating ethical principles of non-maleficence and beneficence. Professional reasoning. Professionals should approach performance data with a critical and analytical mindset. The decision-making process should involve 1. Understanding the context of the data, including patient demographics, comorbidities, and treatment protocols. 2. Critically appraising the performance metrics themselves for validity and reliability. 3. Triangulating the data with other sources of information, such as patient charts, direct patient observation, and peer consultation. 4. Identifying potential root causes for observed trends, considering both system-level factors and individual patient variables. And 5. Developing and implementing evidence-based strategies for improvement, followed by ongoing monitoring and evaluation. This systematic approach ensures that interventions are targeted, effective, and ethically sound, upholding the highest standards of advanced practice nursing. Question 9. Stakeholder feedback indicates that patients sometimes feel overwhelmed or anxious during initial health history taking, leading to reluctance in sharing complete information. As a clinical nurse specialist, when initiating a comprehensive health history with a new patient who appears guarded, which approach best facilitates accurate and complete data collection while respecting patient comfort and autonomy? Option A. Immediately proceed with a standardized, exhaustive checklist of all potential health concerns, ensuring no detail is missed from the outset. Option B. Begin with open-ended questions about their general well-being and reasons for seeking care, gradually progressing to more specific inquiries as rapport is established and the patient appears more comfortable. Option C. Politely acknowledge their guardedness and state that you will only ask questions they are comfortable answering, omitting any potentially sensitive topics. Option D. Gently but firmly explain the necessity of obtaining all information for their care, encouraging them to share everything immediately to expedite the process. The correct answer is B. Begin with open-ended questions about their general well-being and reasons for seeking care, gradually progressing to more specific inquiries as rapport is established and the patient appears more comfortable. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the clinical nurse specialist, CNS, to balance the immediate need for comprehensive health information with the patient's expressed discomfort and potential for distress. The CNS must navigate the ethical imperative of beneficence, acting in the patient's best interest and non-maleficence, avoiding harm, while respecting patient autonomy and privacy. The potential for a patient to withhold crucial information due to anxiety or perceived judgment necessitates a sensitive and skilled approach to history taking. Correct approach analysis. The correct approach prioritizes building rapport and trust before delving into sensitive areas. This aligns with the ethical principles of patient-centered care and respect for dignity, which are foundational in nursing practice and often reflected in professional standards and regulatory guidelines. By starting with open-ended questions about general well-being and gradually progressing to more specific inquiries, the CNS creates a safe environment. This allows the patient to feel heard and understood, increasing the likelihood of accurate and complete disclosure. This method respects the patient's pace and comfort level, minimizing the risk of iatrogenic harm, distress caused by the healthcare provider. Regulatory frameworks for nursing practice, such as those governing the scope of practice for CNSs, emphasize the importance of effective communication and therapeutic relationships in assessment. Incorrect approaches analysis. An approach that immediately launches into a detailed, intrusive line of questioning, without establishing rapport risks alienating the patient and triggering defensive responses. This could lead to incomplete or inaccurate information, hindering effective care planning, and potentially violating the ethical principle of non-maleficence by causing unnecessary anxiety or distress. It fails to acknowledge the patient's emotional state and may be perceived as disrespectful of their privacy and autonomy. Another incorrect approach would be to avoid sensitive topics altogether due to the patient's initial hesitation. While respecting boundaries is important, a CNS has a professional responsibility to gather necessary health information to provide optimal care. Omitting critical data points due to a lack of skillful inquiry would be a failure of professional duty and could compromise patient safety, violating the principle of beneficence. This approach neglects the CNS's role in comprehensive assessment and advocacy. A third incorrect approach might involve pressuring the patient to disclose information they are not ready to share, or making assumptions about their willingness to disclose. This disregards patient autonomy and can erode trust, making future interactions more difficult. It can also lead to the collection of coerced or unreliable data, which is ethically and professionally unsound. Professional reasoning. Professionals should employ a patient-centered, phased approach to health history taking. This involves 1. Establishing rapport and trust through active listening and empathetic communication. 2. Beginning with general, non-threatening questions to understand the patient's presenting concerns and overall well-being. 3. Gradually introducing more specific and potentially sensitive questions, observing the patient's verbal and non-verbal cues for comfort and readiness. 4. Providing opportunities for the patient to ask questions and express concerns. 5. Explaining the purpose of the questions and assuring confidentiality. This systematic and sensitive approach ensures comprehensive data collection while upholding ethical obligations and regulatory standards for quality patient care. Question 10. System analysis indicates a clinical nurse specialist, CNS, is managing a patient with a complex chronic condition requiring multiple pharmacologic agents. The CNS is evaluating the optimal therapeutic strategy, considering the patient's age, renal function, and concurrent use of other medications. Which of the following approaches best reflects the CNS's advanced practice role and regulatory obligations in this scenario? Option A. Selecting the most potent pharmacologic agent available for the primary condition, assuming it will provide the greatest benefit. Option B. Recommending a regimen based on the prescribing physician's historical preferences for similar cases, without independent critical evaluation. Option C. Developing an individualized pharmacotherapy plan that considers the patient's specific physiological status, potential drug interaction, and patient preferences supported by current evidence-based guidelines. Option D. Prioritizing pharmacologic interventions based on the latest published clinical trial data, irrespective of individual patient factors or potential drug interactions. The correct answer is A. Selecting the most potent pharmacologic agent available for the primary condition, assuming it will provide the greatest benefit. Explanation. This scenario presents a professional challenge for a clinical nurse specialist, CNS, due to the critical nature of managing complex pharmacotherapy in a vulnerable patient population. The CNS must navigate the nuances of advanced pharmacology, considering not only efficacy, but also patient-specific factors, potential drug interactions, and adherence challenges, all within the established regulatory framework for advanced practice nursing. Careful judgment is required to ensure patient safety and optimal therapeutic outcomes. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based, and individualized assessment of the patient's pharmacologic needs. This aligns with the CNS's role in promoting health and preventing illness through expert clinical judgment and the application of advanced knowledge. Specifically, it adheres to the regulatory framework that mandates advanced practice registered nurses, APN, to conduct thorough patient assessments, develop individualized care plans, and monitor patient responses to treatment. Ethical principles of beneficence and non-maleficence are upheld by ensuring the chosen pharmacotherapy is the safest and most effective for the patient. An incorrect approach that focuses solely on the most potent agent without considering patient comorbidities or potential interactions represents a failure to adhere to the regulatory requirement for individualized care planning. This could lead to adverse drug events, violating the ethical principle of non-maleficence. Another incorrect approach that relies on outdated guidelines or anecdotal evidence, rather than current evidence-based practice, demonstrates a lack of professional accountability and a failure to maintain current knowledge, which is often a regulatory expectation for APN. Furthermore, an approach that neglects to involve the patient in decision-making regarding their medication regimen without a clear clinical justification undermines patient autonomy and may lead to poor adherence, contravening ethical and potentially regulatory expectations for patient-centered care. Professional decision-making in similar situations should involve a systematic process. First, conducting a thorough patient assessment, including a detailed history, physical examination, and review of current medications and comorbidities. Second, consulting current, evidence-based guidelines and literature to identify appropriate pharmacologic options. Third, critically evaluating these options in the context of the individual patient's needs, preferences, and potential risks and benefits. Fourth, collaborating with the patient and interdisciplinary team to develop and implement a safe and effective pharmacotherapy plan. Finally, establishing a robust monitoring plan to assess efficacy, identify adverse events, and make necessary adjustments. Question 11. Operational review demonstrates a patient presenting with acute, severe abdominal pain, nausea, and vomiting. The patient has a history of peptic ulcer disease. The clinical nurse specialist, CNS, is consulted to assist with management. Which of the following approaches best reflects the CNS's role and responsibilities in this situation? Option A. Conduct a comprehensive physical assessment. Review the patient's medical history and current medications. Consult current evidence-based guidelines for acute abdominal pain and peptic ulcer complications, and collaborate with the physician to develop a diagnostic and treatment plan. Option B. Rely on previous experience managing similar patients and initiate a standard protocol for nausea and vomiting relief while awaiting physician assessment. Option C. Focus on educating the patient about lifestyle modifications to prevent future ulcer flare-ups, assuming the current symptoms are a minor exacerbation. Option D. Immediately administer a strong opioid analgesic to manage the severe pain and monitor for vital sign changes. The correct answer is A. Conduct a comprehensive physical assessment, review the patient's medical history and current medications, consult current evidence-based guidelines for acute abdominal pain and peptic ulcer complications, and collaborate with the physician to develop a diagnostic and treatment plan. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a complex gastrointestinal disorder with potential for rapid deterioration and significant patient impact. The clinical nurse specialist, CNS, must balance evidence-based practice, patient advocacy, and interdisciplinary collaboration within the established regulatory framework for advanced practice nursing. The need for prompt, accurate assessment and intervention, while respecting patient autonomy and resource limitations, requires careful judgment. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment to accurately diagnose the underlying cause of the patient's symptoms. This aligns with the CNS's role in promoting quality patient outcomes and adhering to the scope of practice defined by regulatory bodies. By consulting relevant literature and evidence-based guidelines, the CNS ensures interventions are safe, effective, and current. Furthermore, involving the interdisciplinary team, including the physician, is crucial for coordinated care and timely management of potentially serious conditions, as mandated by collaborative practice agreements and healthcare system policies. This approach upholds ethical principles of beneficence and non-maleficence by ensuring the patient receives appropriate and timely care. Incorrect approach is analysis. An approach that solely relies on anecdotal experience or past practice without current evidence-based validation fails to meet the professional standard of care and regulatory expectations for advanced practice. This could lead to suboptimal or even harmful interventions, violating the principle of beneficence. Focusing exclusively on symptom management without investigating the root cause neglects the diagnostic and consultative role of the CNS, potentially masking a more serious underlying condition. This deviates from the CNS's responsibility to promote health and prevent disease progression, and could be seen as a failure to adhere to professional standards of comprehensive care. Initiating treatment without physician consultation or a clear collaborative agreement, depending on the specific state's Nurse Practice Act and facility policies, could represent an overstep of the CNS's scope of practice. This could lead to regulatory violations and compromise patient safety by bypassing established communication channels for critical care decisions. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough assessment, integrating patient history, physical examination, and diagnostic data. This is followed by the identification of key problems and the formulation of differential diagnoses. Next, evidence-based interventions are considered, taking into account patient preferences and the interdisciplinary team's expertise. Finally, the plan is implemented, continuously evaluated, and revised as needed, always within the legal and ethical boundaries of advanced practice nursing. Question 12. Quality control measures reveal a clinical nurse specialist, CNS, managing a patient with newly diagnosed chronic kidney disease, CKD stage 3. The patient presents with fatigue, edema, and elevated blood pressure. The CNS is considering several management strategies. Which of the following approaches best aligns with regulatory requirements for advanced practice nursing in managing renal system disorders? Option A. Focus primarily on managing the patient's fatigue with rest and energy conservation techniques, as this is a common symptom of CKD. Option B. Independently adjust the patient's existing medications without consulting the nephrology team, assuming familiarity with common CKD treatments. Option C. Initiate a comprehensive medication review. Collaborate with the nephrology team to adjust antihypertensive and diuretic therapy based on current CKD management guidelines, and develop a patient education plan focusing on dietary modifications and fluid management. Option D. Recommend over-the-counter herbal supplements known to support kidney health, based on anecdotal evidence from a colleague. The correct answer is C. Initiate a comprehensive medication review. Collaborate with the nephrology team to adjust antihypertensive and diuretic therapy based on current CKD management guidelines, and develop a patient education plan focusing on dietary modifications and fluid management. Explanation. This scenario presents a professional challenge due to the critical nature of managing patients with renal system disorders, where deviations from established protocols can have severe consequences. The CNS must balance evidence-based practice with patient-specific needs and regulatory compliance. The challenge lies in ensuring that interventions are not only clinically effective, but also adhere to the specific standards of care and documentation required by the governing regulatory bodies for advanced practice nursing. The correct approach represents best professional practice because it prioritizes patient safety and adherence to the established scope of practice for a clinical nurse specialist. This involves a comprehensive assessment, consultation with the interdisciplinary team, and the implementation of evidence-based interventions tailored to the patient's specific renal condition, all while meticulously documenting the process. This aligns with regulatory frameworks that mandate competent and ethical practice, emphasizing patient outcomes and the responsible use of advanced nursing skills. An incorrect approach that focuses solely on symptom management without addressing the underlying renal pathology fails to meet the comprehensive care standards expected of a CNS. This could lead to delayed diagnosis of progression or complications, violating ethical obligations to provide holistic care and potentially contravening regulatory requirements for thorough patient assessment and management. Another incorrect approach that bypasses established communication channels with the primary nephrology team risks fragmented care and potential medication errors or conflicting treatment plans. This undermines the collaborative nature of patient care, a cornerstone of safe practice and a common regulatory expectation for advanced practitioners working within a healthcare system. It also fails to leverage the expertise of the entire team, which is crucial for complex renal disorders. A further incorrect approach that relies on outdated protocols or personal anecdotal experience rather than current evidence-based guidelines is a direct violation of professional standards and regulatory mandates for continuing education and evidence-based practice. This can result in suboptimal patient outcomes and expose the CNS to professional liability. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly assess the patient's current status and renal function. Second, consult relevant, up-to-date evidence-based guidelines and institutional protocols. Third, collaborate with the interdisciplinary team, including physicians, pharmacists, and other specialists. Fourth, develop and implement a patient-centered care plan. And finally, continuously monitor the patient's response and adjust the plan as needed, ensuring accurate and timely documentation throughout. This iterative process ensures that care is safe, effective, and compliant with all applicable regulations. Question 13. Cost-benefit analysis shows that implementing a comprehensive lifestyle modification program for patients with chronic hypertension, focusing on stress reduction techniques, dietary adjustments, and regular physical activity, is more effective in the long term than solely relying on increased pharmacological interventions. A clinical nurse specialist, CNS, is tasked with developing and overseeing this program. Which of the following approaches best aligns with the CNS's role in promoting homeostasis and allostasis for these patients? Option A. Collaborate with the patient to identify specific stressors contributing to their allostatic load, co-create a personalized plan incorporating evidence-based stress management strategies and achievable lifestyle modifications, and facilitate access to community resources and support groups. Option B. Refer the patient to a registered dietitian for dietary counseling and a physical therapist for an exercise prescription, with minimal direct involvement from the CNS beyond initial assessment and final review of recommendations. Option C. Prescribe a higher dosage of antihypertensive medications and monitor blood pressure readings closely, advising the patient to report any significant side effects or uncontrolled readings. Option D. Develop a patient education module that emphasizes the physiological mechanisms of hypertension and the benefits of lifestyle changes, empowering patients to independently implement these modifications and schedule follow-up appointments for medication adjustments as needed. The correct answer is D. Develop a patient education module that emphasizes the physiological mechanisms of hypertension and the benefits of lifestyle changes, empowering patients to independently implement these modifications and schedule follow-up appointments for medication adjustments as needed. Explanation. This scenario presents a professional challenge for a clinical nurse specialist, CNS, due to the inherent complexity of managing chronic conditions that impact homeostases and allostases. The CNS must balance the immediate needs of the patient with long-term health outcomes, considering the patient's environment, resources, and adherence capabilities. This requires a nuanced understanding of physiological stress responses and the body's adaptive mechanisms, moving beyond simple symptom management to address the underlying systemic dysregulation. The challenge is amplified by the need to integrate evidence-based practice with individualized care plans, ensuring that interventions are not only clinically effective, but also culturally sensitive and economically viable for the patient. The correct approach represents best professional practice because it prioritizes a holistic, patient-centered strategy that directly addresses the core physiological and psychosocial factors contributing to the patient's allostatic load. By focusing on identifying and mitigating stressors, promoting adaptive coping mechanisms, and empowering the patient through education and shared decision-making, the CNS aligns with the ethical principles of beneficence, non-maleficence, and patient autonomy. This approach is supported by the regulatory framework for CNS practice, which emphasizes the role of advanced practice nurses in health promotion, disease prevention, and complex care management, advocating for patient well-being and optimal functioning within their environment. The emphasis on interdisciplinary collaboration further ensures comprehensive care that respects the patient's physiological and psychosocial needs. An incorrect approach that solely focuses on pharmacological interventions without addressing the underlying stressors fails to meet the standards of advanced nursing practice. This approach is ethically problematic as it may lead to polypharmacy, masking symptoms without resolving the root cause of allostatic overload, potentially causing harm, non-maleficence violation. It also neglects the patient's active role in their health, undermining autonomy. Another incorrect approach that relies solely on patient self-management without adequate support and education is also ethically flawed. This can lead to patient frustration, non-adherence, and worsening health outcomes, violating the principle of beneficence. Furthermore, it fails to acknowledge the CNS's responsibility to provide education and support, which is a core component of advanced practice. A third incorrect approach that prioritizes cost-effectiveness over individualized patient needs, such as recommending less effective but cheaper interventions, is ethically unacceptable. This can lead to suboptimal care and potentially harm the patient, violating beneficence and non-maleficence, and may also contravene regulations that mandate evidence-based, patient-appropriate care. The professional decision-making process for similar situations should involve a systematic assessment of the patient's homeostatic and allostatic status, including identifying physiological and psychosocial stressors. This should be followed by a collaborative development of a care plan that integrates evidence-based interventions with the patient's goals and preferences. Continuous evaluation of the plan's effectiveness and adjustment based on patient response and evolving needs are crucial. The CNS should also advocate for necessary resources and support systems for the patient and engage in interdisciplinary communication to ensure coordinated care. Question 14. Risk assessment procedures indicate a patient taking warfarin for atrial fibrillation and amiodarone for heart failure is experiencing a potential increase in international normalized ratio INR. The clinical nurse specialist, CNS, is reviewing the patient's medication regimen. Which of the following actions best reflects the CNS's regulatory and ethical responsibilities in managing this complex drug interaction? Option A. Conduct a thorough review of current literature and clinical guidelines regarding the interaction between warfarin and amiodarone. Assess the patient's recent dietary intake of vitamin K, and collaborate with the prescribing physician and pharmacist to develop a revised anticoagulation management plan, including potential medication adjustments and increased INR monitoring frequency. Option B. Rely solely on the electronic health record's automated alert for potential warfarin-amiodarone interaction, and document the alert without further independent assessment or intervention. Option C. Provide the patient with a comprehensive list of all possible adverse effects of both warfarin and amiodarone, and instruct them to report any new symptoms to their primary care physician. Option D. Advise the patient to immediately discontinue amiodarone and inform them of the potential risks associated with stopping this medication abruptly. The correct answer is A. Conduct a thorough review of current literature and clinical guidelines regarding the interaction between warfarin and amiodarone. Assess the patient's recent dietary intake of vitamin K, and collaborate with the prescribing physician and pharmacist to develop a revised anticoagulation management plan, including potential medication adjustments and increased INR monitoring frequency. Explanation. This scenario is professionally challenging because the clinical nurse specialist, CNS, must navigate complex drug interactions and potential adverse effects in a patient with multiple comorbidities, requiring a nuanced understanding of pharmacology and patient-specific factors. The CNS's role extends beyond simply identifying potential issues to actively intervening to ensure patient safety and optimize therapeutic outcomes, all while adhering to regulatory standards for advanced practice nursing. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment and collaborative intervention. This aligns with the regulatory framework for CNS practice, which mandates the application of advanced nursing knowledge and skills to improve patient care. Specifically, it emphasizes the CNS's responsibility to conduct thorough patient assessments, critically evaluate drug information, consult with the interdisciplinary team, and implement evidence-based strategies to manage drug interactions and adverse effects. This proactive and collaborative approach minimizes patient risk and upholds the ethical obligation to provide safe and effective care, consistent with professional standards and guidelines for advanced practice. An incorrect approach that involves solely relying on the electronic health record, AIR, alerts fails to acknowledge the limitations of automated systems. EHR alerts can generate false positives or miss subtle interactions, and they do not account for individual patient factors like renal or hepatic function, genetic predispositions, or adherence issues. This approach represents a regulatory failure by neglecting the CNS's professional responsibility for independent critical thinking and clinical judgment, potentially leading to suboptimal or harmful patient care. Another incorrect approach that focuses on educating the patient about all potential interactions without a clear plan for management is insufficient. While patient education is crucial, it must be coupled with a structured plan to mitigate identified risks. Without this, the patient may experience undue anxiety or confusion, and the underlying clinical problem remains unaddressed, constituting a failure to provide comprehensive care and potentially violating standards of practice that require active management of identified risks. A third incorrect approach that involves deferring all management decisions to the prescribing physician without independent assessment or recommendation overlooks the CNS's advanced scope of practice. The CNS is expected to contribute expert knowledge and clinical judgment to the care plan. Simply passing the problem to another provider without engaging in the assessment and formulation of potential solutions represents a failure to utilize advanced practice skills and a potential breach of professional responsibility. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly assess the patient, including their medical history, current medications, allergies, and physiological status. 2. Critically evaluate potential drug interactions and adverse effects using reliable, up-to-date resources, considering the patient's specific context. 3. Collaborate with the interdisciplinary team, including physicians, pharmacists, and other nurses, to discuss findings and formulate a management plan. 4. Develop and implement evidence-based interventions, including medication adjustments, patient monitoring, and education. 5. Continuously evaluate the effectiveness of interventions and adjust the plan as needed. Question 15. System analysis indicates a clinical nurse specialist, CNS, is leading the development of a new protocol for managing a common patient condition. The CNS has identified several promising research articles suggesting a novel therapeutic approach. Which of the following approaches best exemplifies the principles of evidence-based practice in this scenario? Option A. Implementing the novel therapeutic approach immediately based on the most compelling single research article, assuming it represents the latest advancement. Option B. Conducting a thorough systematic review of the literature, critically appraising multiple studies, and collaborating with the interdisciplinary team to assess the feasibility and applicability of the evidence before protocol development. Option C. Relying primarily on the existing protocol and incorporating minor adjustments based on the anecdotal experiences of senior nursing staff regarding the new approach. Option D. Adopting the novel therapeutic approach based on its popularity in recent nursing journals, without a detailed critical appraisal of the underlying research. The correct answer is A. Implementing the novel therapeutic approach immediately based on the most compelling single research article, assuming it represents the latest advancement. Explanation. This scenario presents a professional challenge for a clinical nurse specialist, CNS, tasked with integrating evidence-based practice, EB, into a new protocol. The challenge lies in balancing the imperative to use the best available evidence with the practical realities of implementation, including resource constraints and the need for buy-in from the clinical team. Careful judgment is required to ensure that the chosen approach to EBP is both scientifically sound and clinically feasible, ultimately leading to improved patient outcomes. The correct approach represents best professional practice because it prioritizes a systematic and comprehensive evaluation of the evidence, followed by a collaborative and context-specific implementation strategy. This aligns with professional nursing standards and ethical obligations to provide high-quality, evidence-informed care. Specifically, it adheres to the principles of EBP by ensuring that clinical decisions are based on the most current and relevant research, critically appraised for validity and applicability. Furthermore, involving stakeholders in the process fosters ownership and facilitates successful adoption, which is crucial for sustained practice change. An incorrect approach that relies solely on anecdotal experience or outdated guidelines fails to meet the core tenets of EBP. This represents a regulatory and ethical failure because it deviates from the professional standard of care, potentially exposing patients to suboptimal or even harmful interventions. Relying on a single, potentially biased, or low-level study without considering the broader body of evidence is also a failure, as it may lead to the adoption of an intervention that is not robustly supported or is inappropriate for the specific patient population. Ignoring the feasibility and resource implications of implementing new evidence can lead to a protocol that is impossible to sustain, rendering the EBP effort ineffective and potentially creating frustration and resistance within the clinical team. The professional decision-making process for similar situations should involve a structured approach to EBP. This includes identifying a clinical question, conducting a thorough literature search, critically appraising the evidence, synthesizing the findings, integrating the evidence with clinical expertise and patient values, evaluating the outcomes of the change, and disseminating the results. Crucially, this process must be iterative and adaptable, acknowledging that EBP is an ongoing cycle of learning and improvement. Collaboration with colleagues, including physicians, other nurses, and administrators, is essential throughout this process to ensure that the evidence is translated into practice effectively and ethically. Question 16. The risk matrix shows a high likelihood of complications arising from impaired cellular oxygenation in patients with chronic obstructive pulmonary disease, COPD, As a clinical nurse specialist, CNS, what is the most appropriate initial implementation strategy to address this identified risk? Option A. Develop and deliver a targeted educational program for the nursing staff, focusing on the pathophysiology of impaired gas exchange and COPD, early recognition of hypoxemia, and evidence-based interventions for optimizing oxygenation and ventilation. Option B. Initiate individual patient consultations for all patients admitted with COPD exacerbations to assess their current oxygenation status and provide personalized education. Option C. Advocate for the immediate purchase of advanced non-invasive ventilation equipment for all medical surgical units caring for COPD patients. Option D. Immediately revise all existing COPD care pathways to include more aggressive oxygen titration protocols based on current clinical guidelines. The correct answer is A. Develop and deliver a targeted educational program for the nursing staff focusing on the pathophysiology of impaired gas exchange and COPD, early recognition of hypoxemia, and evidence-based interventions for optimizing oxygenation and ventilation. Explanation: the risk matrix shows a high likelihood of adverse events related to a specific disease mechanism, particularly in a vulnerable patient population. This scenario is professionally challenging because it requires the clinical nurse specialist, CNS, to translate complex pathophysiological understanding into actionable, evidence-based interventions that mitigate risk within the constraints of clinical practice and regulatory requirements. The CNS must consider not only the biological mechanisms, but also the systemic factors influencing patient outcomes and the feasibility of implementing changes. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and collaborative strategy. It involves a thorough assessment of the current care delivery model, identification of specific gaps in knowledge or practice related to the disease mechanism, and the development of targeted educational strategies for the healthcare team. This aligns with the CNS role as an expert clinician, educator, and change agent, promoting quality improvement and patient safety. It also adheres to professional standards that mandate the use of evidence to guide practice and the continuous evaluation of outcomes. Regulatory frameworks for advanced practice nursing emphasize the CNS's responsibility in improving patient care through the application of nursing science and the promotion of a safe healthcare environment. An incorrect approach that focuses solely on individual patient management without addressing systemic issues fails to leverage the CNS's unique role in influencing practice at a broader level. This neglects the opportunity to prevent future adverse events and may lead to continued suboptimal care. Ethically, this approach falls short of the obligation to promote the well-being of all patients within the system. Another incorrect approach that relies on anecdotal evidence or personal opinion rather than established research and guidelines is professionally unacceptable. This violates the principle of evidence-based practice, which is a cornerstone of safe and effective nursing care. Regulatory bodies expect advanced practitioners to base their decisions on the best available scientific evidence. A third incorrect approach that bypasses interdisciplinary collaboration and attempts to implement changes unilaterally is also problematic. It undermines the team-based nature of healthcare and can lead to resistance, lack of buy-in, and ultimately, failure of the proposed interventions. Professional nursing ethics and regulatory guidelines emphasize the importance of teamwork and communication in achieving optimal patient outcomes. The professional decision-making process for similar situations should involve a structured approach. 1. Recognize the problem and its potential impact, as indicated by the risk matrix. 2. Conduct a comprehensive assessment, including a review of current practices, patient, and relevant literature. 3. Identify the root causes of the identified risks, focusing on the underlying disease mechanisms and their clinical manifestations. 4. Develop evidence-based strategies that address these root causes, considering feasibility and sustainability. 5. Engage stakeholders, including physicians, nurses, and other healthcare professionals, in the development and implementation of these strategies. 6. Implement the chosen interventions and establish mechanisms for ongoing monitoring and evaluation of their effectiveness. 7. Disseminate findings and advocate for sustained practice changes. Question 17. Process analysis reveals a clinical nurse specialist, CNS, is caring for an elderly patient with severe COPD who is refusing a non-invasive ventilation (NIV) mask despite increasing respiratory distress and hypoxemia. The patient states, I can't breathe with that thing on my face. It makes me feel like I'm drowning. The CNS has assessed the patient's vital signs and oxygen saturation, which are deteriorating, and the medical team believes NIV is crucial to prevent further decline and potential intubation. How should the CNS proceed to ethically and professionally manage this situation? Option A. Immediately inform the patient that refusal is not an option given their critical condition, and proceed with applying the NIV mask, explaining that it is for their own good. Option B. Document the patient's refusal and inform the medical team to prepare for intubation without further discussion or attempts to address the patient's concerns about the mask. Option C. Engage the patient in a calm, empathetic conversation to understand the specific fears and sensations associated with the NIV mask. Provide clear and simple explanations about how NIV works to support breathing, and explore potential modifications to the mask or delivery system, while continuously reassessing the patient's understanding and comfort level. Option D. Contact the patient's adult children to explain the situation, and ask them to persuade the patient to accept the NIV mask, as they are more likely to listen to family. The correct answer is C. Engage the patient in a calm, empathetic conversation to understand the specific fears and sensations associated with the NIV mask. Provide clear and simple explanations about how NIV works to support breathing, and explore potential modifications to the mask or delivery system, while continuously reassessing the patient's understanding and comfort level. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the conflict between a patient's expressed wishes and the perceived best interests of the patient, as interpreted by the healthcare team. The CNS must navigate the ethical principles of autonomy, respecting the patient's right to self-determination and beneficence, acting in the patient's best interest. The complexity arises from the patient's diminished capacity to fully comprehend the implications of their refusal, necessitating a delicate balance between respecting their current stated preference and ensuring their safety and well-being. The CNS's role as an advocate and expert in respiratory care is paramount in facilitating informed decision-making. Correct approach analysis. The correct approach involves a comprehensive, multifaceted assessment of the patient's respiratory status and their capacity to make informed decisions. This includes a thorough physical examination, review of diagnostic data, and a detailed exploration of the patient's understanding of their condition, the proposed treatment, and the potential consequences of refusal. Crucially, it requires engaging in a patient-centered conversation to understand the underlying reasons for their refusal, which may stem from fear, past negative experiences, or misperceptions. The CNS must then use this information to provide clear, understandable education, addressing the patient's concerns and exploring alternative strategies or modifications to the treatment plan that might be more acceptable to them, while always prioritizing their safety. This aligns with the ethical imperative to uphold patient autonomy while also acting beneficently, ensuring that any decision is as informed as possible given the patient's circumstances. Regulatory frameworks for nursing practice emphasize patient advocacy, informed consent, and the provision of high-quality, individualized care. Incorrect approaches analysis. One incorrect approach would be to immediately override the patient's refusal and proceed with the treatment based solely on the clinical team's assessment of necessity. This disregards the principle of patient autonomy and the legal and ethical requirements for informed consent, fails to explore the patient's perspective or attempt to address their concerns, potentially leading to a breakdown in the therapeutic relationship and a violation of the patient's rights. Another incorrect approach would be to accept the patient's refusal without further investigation or attempts at education and clarification, especially if there is evidence of impaired decision-making capacity. This could be considered a failure of beneficence, as the CNS would not be acting in the patient's best interest by allowing a potentially harmful outcome due to a lack of understanding or a reversible barrier to consent. It also fails to fulfill the professional obligation to advocate for the patient's well-being. A third incorrect approach would be to involve family members in making the decision for the patient without first thoroughly assessing the patient's own capacity and wishes, or without the patient's explicit consent to involve them. While family can be a valuable resource, the primary decision maker, if capable, is the patient. Circumventing the patient's direct involvement when they have some level of capacity can undermine their autonomy and create ethical conflicts. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough assessment of the patient's clinical status and their capacity for decision-making. This involves active listening, empathetic communication, and a commitment to patient-centered care. When faced with a conflict between patient wishes and clinical recommendations, the professional should prioritize understanding the patient's perspective, providing clear and accessible information, and collaboratively exploring all available options. If capacity is questionable, a formal assessment process should be initiated, and if necessary, ethical consultation sought. The ultimate goal is to reach a decision that respects the patient's autonomy to the greatest extent possible, while ensuring their safety and well-being, in accordance with professional standards and ethical principles. Question 18. Quality control measures reveal that a patient with type 2 diabetes, managed by a clinical nurse specialist, CNS, is experiencing persistent hyperglycemia despite being on a prescribed oral hypoglycemic agent and a structured lifestyle modification plan. The patient reports feeling overwhelmed by the medication regimen and expresses concerns about potential side effects, though they are vague about specifics. The CNS needs to address this suboptimal glycemic control. Which of the following approaches best reflects current regulatory and ethical standards for advanced practice nursing and medication management for chronic diseases? Option A. Conduct a thorough patient interview to explore the patient's understanding of their medication, perceived barriers to adherence, and the impact of the regimen on their daily life. Then collaboratively develop a revised, patient-centered medication management plan. Option B. Immediately increase the dosage of the current oral hypoglycemic agent to achieve better glycemic control, as per standard treatment protocols for hyperglycemia. Option C. Advise the patient to strictly adhere to the current medication regimen and lifestyle plan, emphasizing the importance of compliance for long-term health outcomes. Option D. Prescribe a more potent or additional oral hypoglycemic agent to aggressively lower blood glucose levels, given the current suboptimal control. Correct answer is A. Conduct a thorough patient interview to explore the patient's understanding of their medication, perceived barriers to adherence, and the impact of the regimen on their daily life, then collaboratively develop a revised, patient-centered medication management plan. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a complex interplay of patient safety, adherence to evidence-based practice, and the ethical imperative to provide individualized care within the constraints of established protocols. The CNS must balance the need for standardized, safe medication management with the unique needs and potential barriers faced by a patient with a chronic, complex condition. The risk of adverse events, suboptimal therapeutic outcomes, and patient dissatisfaction necessitates a thorough and nuanced approach. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered assessment. This aligns with the core principles of advanced nursing practice, emphasizing holistic care and the application of clinical judgment. Specifically, it adheres to regulatory frameworks that mandate individualized care plans and patient education. By directly engaging the patient to understand their medication regimen's impact on their daily life, identifying potential barriers, e.g., cost, side effects, understanding, and collaboratively developing a revised plan, the CNS ensures that the medication management strategy is not only clinically sound, but also practical and sustainable for the patient. This approach upholds the ethical duty of beneficence and non-maleficence by actively seeking to optimize outcomes and minimize harm. It also reflects the professional responsibility to advocate for patients and empower them in their healthcare journey. Incorrect approaches analysis. One incorrect approach involves immediately adjusting the medication dosage based solely on the reported suboptimal control without further investigation. This fails to meet regulatory requirements for thorough patient assessment and individualized care planning. It bypasses the crucial step of understanding the root cause of the suboptimal control, which could be related to adherence issues, lifestyle factors, or other unaddressed comorbidities, rather than simply the prescribed dosage. This approach risks overtreatment, potential adverse drug reactions, and does not address the underlying problem, leading to continued suboptimal outcomes and potential patient harm, violating the principle of non-maleficence. Another incorrect approach is to simply reinforce the current medication regimen and advise the patient to adhere more strictly, without exploring the patient's perspective or potential barriers. This neglects the professional responsibility to assess and address factors influencing adherence. Regulatory guidelines emphasize patient education and shared decision-making. Dismissing the patient's reported challenges without investigation is ethically problematic, potentially leading to patient disengagement, frustration, and continued poor health outcomes. It fails to uphold the principle of patient autonomy and can be seen as a failure in providing adequate support and resources. A further incorrect approach is to escalate the medication regimen to a more complex or potent therapy without a detailed assessment of the current regimen's effectiveness and the patient's ability to manage it. This can lead to increased polypharmacy, higher risk of drug interactions, and a greater burden on the patient, potentially exacerbating adherence issues. It bypasses the opportunity to optimize the existing treatment plan and may not be the most appropriate or safest course of action, violating principles of prudent prescribing and patient safety. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive assessment of the patient's current status, including their disease progression, current medication regimen, and any reported challenges. This should be followed by an exploration of potential contributing factors, such as adherence, understanding, side effects, and socioeconomic influences. Collaborative goal setting with the patient is essential, followed by the development and implementation of an individualized care plan. Ongoing monitoring and evaluation are critical to ensure the plan's effectiveness and to make necessary adjustments. This process ensures that interventions are evidence-based, patient-centered, and ethically sound. Question 19. The monitoring system demonstrates a sustained decrease in tissue oxygen saturation and an increase in serum lactate levels in a patient recovering from a surgical procedure. The CNS is tasked with evaluating the patient's cellular and tissue response to potential postoperative injury. Which of the following approaches best reflects current best practice for this evaluation? Option A. Immediately escalate care to the surgical team, requesting a return to the operating room without further independent assessment of the cellular and tissue response. Option B. Reassure the patient that these findings are common postoperative occurrences and monitor for significant changes in vital signs. Option C. Conduct a comprehensive review of the patient's cellular and tissue response to injury, correlating the monitoring data with known pathophysiological mechanisms of ischemia and reperfusion, and consult relevant evidence-based protocols for managing compromised tissue perfusion. Option D. Initiate a rapid infusion of intravenous fluids and broad-spectrum antibiotics to address potential sepsis and improve tissue perfusion. The correct answer is D. Initiate a rapid infusion of intravenous fluids and broad-spectrum antibiotics to address potential sepsis and improve tissue perfusion. Explanation. This scenario is professionally challenging because it requires the clinical nurse specialist, CNS, to interpret complex physiological data in the context of cellular and tissue responses to injury, while adhering to established best practices and regulatory guidelines for patient care. The CNS must synthesize information from a monitoring system to make informed clinical judgments that directly impact patient outcomes. The correct approach represents best professional practice because it involves a systematic, evidence-based evaluation of the patient's cellular and tissue responses to injury. This approach prioritizes accurate assessment, timely intervention, and continuous monitoring, aligning with the CNS's role in improving patient care through expert clinical practice, consultation, and education. Adherence to regulatory frameworks, such as those governing advanced practice nursing and patient safety, mandates this level of diligence and critical thinking. An incorrect approach that focuses solely on symptomatic relief without addressing the underlying cellular mechanisms of injury fails to meet the standard of care. This could lead to delayed or inadequate treatment, potentially exacerbating the injury and violating ethical principles of beneficence and non-maleficence. Furthermore, it may contravene regulatory requirements for comprehensive patient assessment and management by advanced practice providers. Another incorrect approach that relies on anecdotal evidence or personal experience rather than current research and established protocols is professionally unacceptable. It deviates from evidence-based practice, a cornerstone of modern healthcare, and can result in suboptimal or harmful interventions. Regulatory bodies often mandate adherence to evidence-based guidelines, and failure to do so can have legal and ethical repercussions. A third incorrect approach that involves delegating critical interpretation of cellular injury data to less qualified personnel without appropriate oversight or validation would also be a failure. This undermines the CNS's expert role and could lead to misinterpretation of data and inappropriate clinical decisions, potentially violating patient safety regulations and professional accountability standards. The professional decision-making process for similar situations should involve 1. Thoroughly reviewing all available patient data, including monitoring system readouts, clinical signs, and laboratory results. 2. Applying knowledge of cellular and tissue responses to specific types of injury. 3. Consulting relevant evidence-based guidelines and literature. 4. Collaborating with the interdisciplinary team. 5. Developing and implementing a targeted management plan. 6. Continuously evaluating the patient's response and adjusting the plan as needed. 7. Documenting all assessments, interventions, and outcomes meticulously. Question 20. Assessment of a 68-year-old male with a history of COPD and home oxygen therapy who presents to the clinic reporting increased dyspnea, productive cough with yellowish sputum, and mild chest tightness over the past 48 hours. What is the most appropriate initial clinical decision-making approach for the clinical nurse specialist? Option A. Conduct a comprehensive respiratory and cardiovascular assessment. Review the patient's baseline status and recent medication adherence, and consider differential diagnoses including COPD exacerbation, pneumonia, and potential cardiac involvement. Option B. Immediately initiate intravenous antibiotics and administer a nebulized bronchodilator based on the reported cough and dyspnea. Option C. Refer the patient directly to the emergency department for admission and further workup without performing a detailed in-person assessment. Option D. Advise the patient to increase his home oxygen flow rate and rest, and schedule a follow-up appointment in 1 week. The correct answer is A. Conduct a comprehensive respiratory and cardiovascular assessment, review the patient's baseline status and recent medication adherence, and consider differential diagnoses including COPD exacerbation, pneumonia, and potential cardiac involvement. Explanation. Scenario analysis. This scenario presents a common yet complex clinical challenge for a clinical nurse specialist, CNS, involving a patient with a chronic respiratory disorder experiencing an acute exacerbation. The challenge lies in differentiating between a typical exacerbation requiring standard management and a more insidious complication that might necessitate a different diagnostic pathway or intervention. The CNS must leverage advanced assessment skills, integrate patient history, and consider potential differential diagnoses beyond the obvious, all while adhering to evidence-based practice and regulatory guidelines for advanced nursing practice. The urgency of the situation, coupled with the potential for rapid deterioration, demands a systematic and well-reasoned approach. Correct approach analysis. The correct approach emphasizes a comprehensive, holistic assessment that goes beyond superficial symptoms. It involves a thorough review of the patient's baseline status, current medications, recent exposures, and any subtle changes in their respiratory mechanics or systemic presentation. This aligns with the CNS's role as an expert clinician who synthesizes complex data to inform diagnosis and treatment. Specifically, it reflects the regulatory framework for advanced practice registered nurses, APN, which mandates a high level of critical thinking and diagnostic reasoning, ensuring patient safety and optimal outcomes. This approach prioritizes identifying the root cause of the change in status, which is paramount for effective management and preventing complications. Incorrect approaches analysis. One incorrect approach might involve solely focusing on the patient's reported shortness of breath and administering bronchodilators without a deeper investigation. This fails to meet the regulatory expectation for advanced assessment and diagnostic reasoning. It risks masking a more serious underlying issue, such as a pulmonary embolism or pneumonia, leading to delayed or inappropriate treatment and potential patient harm. Ethically, this represents a failure to provide comprehensive care and uphold the standard of practice expected of an advanced practitioner. Another incorrect approach could be to immediately escalate to a higher level of care, e.g., ICU transfer, based on a single symptom without a thorough differential diagnosis. While patient safety is paramount, premature escalation without adequate assessment can lead to unnecessary resource utilization and patient anxiety. It bypasses the CNS's expertise in managing complex respiratory conditions and may not be the most efficient or effective first step, potentially violating guidelines related to prudent resource management and patient-centered care. A third incorrect approach might be to rely solely on a single diagnostic test, e.g., a chest X-ray, and make treatment decisions based on that in isolation. This neglects the importance of integrating multiple data points, including physical assessment findings, patient history, and other relevant investigations. Regulatory frameworks for APN emphasize a comprehensive, multifaceted approach to diagnosis and treatment planning, not a reliance on isolated findings. This approach risks misdiagnosis and suboptimal patient care. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough, multidimensional assessment. This includes gathering subjective data, patient report, history, and objective data, vital signs, physical examination, review of diagnostic results. The next step involves synthesizing this information to generate a list of differential diagnoses, prioritizing the most likely and most critical. Evidence-based guidelines for respiratory disorders should then be consulted to inform diagnostic workup and initial management strategies. Continuous reassessment and evaluation of the patient's response to interventions are crucial. This iterative process ensures that care is dynamic, responsive, and aligned with best practices and regulatory requirements for advanced nursing practice.